think about that moment, when your dog is just shivering uncontrollably after a walk in the cold.
Mm.
Or maybe your cat seems really, really cold and still after coming back from the vet's office.
Mm.
It hits a nerve, right?
Yeah, it absolutely does. It's that protective instinct kicking in.
Exactly. And today we're going to take a real deep dive into what's actually going on there. We're talking about veterinary hypothermia when an animal's body temperature drops, well, dangerously low.
Right. And to really get our heads around this, we've mainly drawn on information from human medical research and also experimental animal studies.
Okay.
Because, while veterinary-specific studies can sometimes be a bit limited, these other fields give us a really solid understanding of how mammals in general respond to cold. It provides a good framework.
Makes sense. So our mission today is basically to sift through all that, pull out the really critical stuff about hypothermia in animals. What causes it, what it does to their bodies, how vets treat it. We want to give you the essential knowledge, but without making it sound like we're just reading from a textbook.
Definitely.
Okay, so let's unpack it. At the most basic level, what is hypothermia?
Simply put, it's when the core body temperature falls below the point needed for normal metabolism. So it messes with the body's internal engine, essentially.
Right.
And what's interesting is we can kind of break it down into two main types: primary and secondary hypothermia.
Primary and secondary. Okay, that sounds like an important difference. What is it?
Well, primary hypothermia is when a basically healthy animal gets overwhelmed by the cold. Their own heating and heat-saving systems just can't keep up.
Okay.
Secondary hypothermia, though, that's different. It's usually a complication of some other illness or condition they already have. So it's not just the cold environment. Something inside them is messing with their temperature control.
Got it. So like a young, healthy dog left out in the snow might get primary hypothermia. But maybe an older cat with, say, kidney disease could get secondary hypothermia, even if it's just, kind of cool inside.
Precisely. And to really gauge how serious things are, we often talk about stages of hypothermia based on their core temperature.
Ah, the stages, right?
So stage 1 is generally between 90 and 95 degrees Fahrenheit. That's 32 to 35 Celsius.
Okay.
Stage 2 is 82 to 90 Fahrenheit, or 28 to 32 Celsius.
Even colder.
Yeah. Stage 3 is quite critical, 75 to 82 Fahrenheit, which is 24 to 28 Celsius. And stage 4 is anything below 75 Fahrenheit or 24 Celsius.
Wow.
Stage 2 is really where you see a major drop in the body's ability to cope, and there's a high risk of the heart becoming unstable.
Those temperature ranges really drive home how even what seems like a small drop can be a really big deal.
Oh.
So, okay, let's step back a bit. How does a healthy animal usually keep its temperature stable?
Right. That's all about thermoregulation. It's this constant balancing act, between heat gained, heat lost to the surroundings, and the heat the body makes itself. That's called central thermogenesis.
Central thermogenesis. Okay.
And the whole thing is run by the hypothalamus in the brain. Think of it like the body's thermostat, always checking temperature sensors all over the body.
The hypothalamus, the control center.
Got it.
So how does heat actually move between the animal and the outside world?
Well, there are 4 main ways. There's evaporation, like when a dog pants, losing heat as moisture turns into vapor.
Right.
Radiation, that's heat transfer through waves, like feeling the warmth of the sun. Convection heat, moving via air or water currents, like the cool breeze. And conduction, direct heat transfer through touch, like lying on a cold tile floor.
Okay, evaporation, radiation, convection, conduction. So those are ways heat gets lost. What about generating heat, that central thermogenesis thing?
Yeah, so that involves a few things. Basal metabolism is just the energy needed to keep basic functions going at rest.
Okay.
Muscle activity, even tiny movements, generates heat. And then especially in newborns, there's something called brown fat. It's a special fat they can uncouple very efficiently to produce heat quickly.
Brown fat. Interesting. So when an animal starts feeling cold, how does the body try to ramp up that heat production?
The main way is shivering. Those involuntary muscle shakes actually produce a fair bit of heat. The basal metabolic rate can also increase. And a lot of this is driven by the sympathetic nervous system, the fight or flight system, and the endocrine system. Hormones get released, like thyroid-releasing hormone, catecholamines.
Like adrenaline.
Exactly. Stress hormones like adrenaline, plus growth hormone, glucocorticoids. These basically signal the body to burn more fuel, use more glucose, and just generally speed up the metabolism.
Right, like flooring the accelerator to warm up the engine.
Yeah.
So what about stopping heat from escaping? How does the body try to conserve heat?
It's got some pretty clever tricks. Cutaneous vasoconstriction is a big one. The blood vessels near the skin tighten up.
Okay.
That reduces blood flow there, so less heat is lost through radiation and convection.
Right.
And there's piloerection, the hair standing on end. Goosebumps, basically. It tries to trap a layer of air for insulation. Works better for furry animals, obviously. And then you've got the behavioral stuff, curling into a ball to make themselves smaller, huddling together, finding shelter.
It's amazing, really, how many different systems are involved in just keeping that temperature steady. But what happens when all that fails and hypothermia actually sets in? How does it start to affect different parts of the body? Maybe start with the heart, the cardiovascular system?
Yeah, the cardiovascular system takes a big hit. In the early stages, mild hypothermia, that sympathetic surge you mentioned, causes tachycardia, a faster heart rate, and that peripheral vasoconstriction. So weirdly, cardiac output and blood pressure might actually be normal or even high at first as the body tries really hard to compensate.
So it's almost like an initial overreaction.
In a way, yeah. But as the temperature keeps dropping, the heart's pacemaker cells slow down. That leads to bradycardia, a slow heart rate. And often this kind of bradycardia doesn't respond well to atropine, which is a common drug we use to speed the heart up. And that initial effort to keep blood pressure up by constricting vessels, it eventually fails. As things get colder, the bradycardia gets worse, and systemic vascular resistance actually starts to decrease because the body isn't releasing as many catecholamines, and the receptors aren't responding as well.
That sounds like a really dangerous shift.
It is. It's a downward spiral.
And what about the heart's electrical activity? I think I've read about ECG changes.
Yes, absolutely. There are some classic signs on an electrocardiogram. One really distinct one is called the Osborn wave or J wave. It's the specific little bump after the main QRS complex.
Right.
You can also see all sorts of irregular heart rhythms, both atrial and ventricular. And the different time intervals on the ECT, the PR, QRS, QT, they all get longer.
Wow.
These ECG changes are super important for vets. They help assess how bad the hypothermia is and how to manage the heart issues. The progression can go from just a slow rhythm, sinus bradycardia, to more serious things like atrial fibrillation, then ventricular fibrillation, and ultimately a cyspal, no electrical activity at all.
That's a really sobering progression. Okay, what about the endocrine system? The hormones?
Well, initially, like we said, that sympathetic activation causes a flood of counter-regulatory hormones. This ramps up glycogenolysis, breaking down stored glucose, and gluconeogenesis, making new glucose, and lipolysis, too, breaking down fat.
Okay.
At the same time, insulin release and uptake get inhibited. So you actually tend to see hyperglycemia, high blood sugar initially. The body's trying to mobilize fuel.
So like an emergency energy dump into the bloodstream.
Pretty much. But if the hypothermia goes on for a while or develops slowly, those glycogen stores get used up. And then paradoxically, you can end up with hypoglycemia, low blood sugar, because the fuel reserves are gone.
Like an energy crash after the initial surge.
Huh.
Okay, what about the digestive system, the GI tract?
Hypothermia really throws off the balance there. You get increased stomach acid production, but less bicarbonate secretion in the duodenum, the first part of the small intestine. That combination increases the risk of stomach ulcers. And ileus, where the intestines just stop moving properly, that's pretty common too.
And the blood itself, clotting, the hemic system.
Yeah, that gets complicated. As fluid moves out of the blood vessels into the tissues, the blood gets more concentrated. That's hemoconcentration.
Okay.
And this can mess with clotting in tricky ways. You can potentially see issues with too much clotting, or conversely, problems with bleeding, hyper or hypocoagulopathy. Plus, the enzymes needed for clotting just don't work as well when they're cold.
Right.
And platelets become less reactive too. So all that together tends to push things towards hypocoagulability, a reduced ability to clot.
So risk of clots and bleeding. That sounds difficult to manage. What about organs like the liver and pancreas?
They're definitely vulnerable. The main issue is reduced oxygen delivery hypoxia that comes with hypothermia. This can damage liver cells, affect liver function, and potentially cause pancreatitis, which is inflammation of the pancreas.
And muscles and joints. I imagine they get stiff.
You're right. The fluid in the joints, the synovial fluid, gets thicker, more viscous when it's cold, and the muscles themselves stiffen up. That contributes to that rigid feeling you sometimes see in hypothermic animals.
Yeah, makes sense. Now, the nervous system, that seems like it would be really sensitive to temperature.
Oh, absolutely. As the core temperature falls, there's a pretty direct, almost linear drop in the metabolic activity of the central nervous system.
Okay.
And that directly affects consciousness. It goes from maybe mild incoordination to lethargy, then obtundation, less responsive, and eventually coma. Nerve signals also travel slower and slower. So it's this gradual slowing down and shutting down of brain and nerve function.
The gradual shutdown.
Yeah.
Okay, how about the kidneys, the renal system?
It's interesting. Initially, that peripheral vasoconstriction we talked about, it actually shunts more blood to the kidneys. So renal blood flow and the filtration rate, the GFR, can actually increase at first. Yeah, leading to more urine production, sometimes called cold diuresis. But then as things get worse, the kidney tubules start to malfunction and they become resistant to antidiuretic hormone, ADH. That also makes them produce more urine.
So they're working overtime?
Initially, yes. But eventually, as the heart's output drops significantly, blood flow to the kidneys decreases, urine production falls off, and there's a real risk of acute kidney injury.
So an initial surge, then potential failure.
Okay.
And lastly, the respiratory system, breathing.
Right. You might see rapid breathing, tachypnea at the very start as the body tries to compensate, but that quickly changes to a slower respiratory rate and shallower breaths, lower tidal volume. Airway secretions tend to increase, and crucially, the protective reflexes, like coughing or gagging, become much less effective. That increases the risk of aspiration pneumonia.
Oh, dear.
Yeah. And below about 93.2 Fahrenheit, or 34 Celsius, the actual drive to breathe gets significantly weaker. You can also get increased resistance in the blood vessels of the lungs, leading to ventilation perfusion mismatch, basically. Air and blood not matching up properly in the lungs.
So less efficient oxygen exchange.
Exactly. Which can lead to hypoventilation, apnea stopping breathing altogether, and sometimes, though rarely, pulmonary edema, fluid in the lungs. Oh, and one more thing. Hypothermia shifts the oxyhemoglobin curve to the left.
Meaning?
Meaning hemoglobin holds on to oxygen more tightly, theoretically making it harder to release it to the tissues. Although that can be complicated by the acidosis, the buildup of acid that often happens at the same time, which pushes the curve the other way.
Wow. Okay, so it really sounds like almost every single system in the body is dramatically affected by a serious drop in temperature. So who's most at risk? Which animals are most vulnerable?
Well, as we said, dogs and cats are our main focus here, and generally smaller breeds are at higher risk.
Why is that?
They have a larger surface area compared to their body volume, so they just lose heat faster.
Makes sense.
Age is also a huge factor. Newborns and very old animals, geriatrics, are much more susceptible. Their ability to regulate temperature just isn't as good. Either it's underdeveloped in the young or less efficient in the old.
Right. Young ones still developing, older systems maybe not working as well. Are there other specific risk factors people should know about?
Yes, definitely quite a few. Animals that are very thin with low body fat or low glycogen stores have less insulation and less fuel to generate heat.
Okay.
Burns are a big one. Damaged skin loses heat very quickly. Any kind of head injury or brain disease can mess with the hypothalamus, that thermostat we talked about.
Right.
Certain underlying diseases make animals more prone to, like hypothyroidism or diabetic ketoacidosis, sepsis, major trauma. Those can impair thermoregulation. And then there's general anesthesia.
Ah, yes. Vets are always careful about that.
Exactly. And certain medications, too, things like beta blockers, some sedatives like barbiturates or phenothiazines, narcotics. They can all interfere with the body's temperature control. If you understand how the body normally stays warm, you can see how each of these things undermines those processes.
That's a really wide range of factors. So how can we, as owners or caregivers, spot the signs? What should we be looking for if we suspect hypothermia?
Well, first, always consider if the animal has any of those underlying conditions we just mentioned. That's important context.
Okay.
Then think about the history. Has there been prolonged exposure to cold? Did the animal go missing? Was there any recent trauma? These are clues. And then the physical exam findings really depend on which stage of hypothermia they're in.
Okay, let's go back through those stages then and look at the specific signs. Stage I, the mildest one.
Right. Stage I, temperature between 90 and 95 Fahrenheit. You'll likely see lethargy, maybe some weakness. Shivering is variable, could be strong, could be weak, might come and go. Heart rate, rhythm, blood pressure, also variable at this stage.
Yeah.
Mucous membranes, like the gums, might look pale pink or even quite pale. Mentally, they might seem confused, agitated, or just dull, obtunded. Breathing rate can also be up or down.
Okay, so still some signs the body is fighting it. What about stage 2? Temperature drops to 82 to 90 Fahrenheit.
Yeah, stage 2, things are looking worse. You'll probably see collapse. Shivering often stops or is much reduced.
Hmm.
You'll likely find bronchoarrhythmia, that's slow, maybe irregular heart rate and low blood pressure, hypotension. Gums will likely be pale. Muscles and joints might feel stiff. Neurologically, they'll be pretty out of it, obtunded, maybe stuporous, meaning they only respond to really strong stimuli, or even comatose.
Hmm.
You might see incoordination, ataxia, and reduced reflexes, hyporeflexia, and their breathing will be slower and shallower.
Definitely sounds much more serious. And stage 3, between 75 and 82 Fahrenheit.
Stage 3 is critical. The animal is likely moribund, near death. Their skin might feel cold and possibly swollen, edematous. Shivering is almost always absent by now. You'll still have the slow heart rate, low blood pressure, pale gums, muscle, and joint stiffness. Neurologically, they'll be comatose, often with fixed, dilated pupils and no reflexes at all. Breathing will be very slow and shallow, or they might have stopped breathing, respiratory arrest. Pulmonary edema, fluid in the lungs, can happen here too.
And stage 4, below 75 Fahrenheit.
Stage 4, sadly, is usually no vital signs detectable, basically cardiac arrest.
Those are really stark, quite frightening signs.
Hmm.
If someone suspects their cat is hypothermic, what else could be causing similar symptoms? What are the differentials a vet would think about?
That's crucial, ruling out other things. For the neurological signs, like the altered consciousness, we'd have to consider primary brain disease, low blood sugar, hypoglycemia, severe anemia, liver problems causing hepatic encephalopathy, severe hypothyroidism called myxedema, electrolyte problems, sepsis, poisoning, even cancer, or sadly, just the natural dying process.
Okay.
And for the slow heart rate specifically, we'd also think about underlying heart disease, side effects from medications, or different types of toxins.
So it sounds like a really thorough exam, and probably some lab tests are absolutely key to figuring out what's really going on. What kind of tests would a vet typically run?
Yeah, usually we'd start with a complete blood count, a CBC, a biochemistry panel looking at organ function and electrolytes, and a urinalysis. But the results can be all over the place, really depending on how severe the hypothermia is and if there are other problems going on too.
Right.
The CBC might show signs of dehydration, like hemoconcentration, maybe low platelets, thrombocytopenia. The biochemistry might show azotemia, kidney waste products building up high or low blood sugar, elevated liver enzymes. The urinalysis might show the kidneys can't concentrate urine properly, that's isostenuria, or maybe glucose in the urine, glucosuria.
So those give a general picture of organ health and metabolic state. Are there more specific tests for hypothermia itself or its effects?
Well, blood gas analysis is really common. That often shows metabolic acidosis, sometimes respiratory acidosis, two common side effects. Coagulation tests might be done looking for things like high fibrinogen or DIC, disseminated intravascular coagulation. But you have to be careful interpreting those because the tests run in the lab at normal temperature might not fully reflect what's happening in the cold body. Things usually correct as the animal warms up.
Okay.
We might also check thyroid hormone levels if hypothyroidism is suspected. And imaging, like X-rays or ultrasound, might be needed to look for complications or other underlying issues.
Right.
Pathological findings, like if an animal passes away, can be pretty non-specific in simple accidental hypothermia, maybe reddish skin, some bleeding in the stomach lining. If it was secondary hypothermia, you'd expect to see signs of whatever the underlying disease was.
So it sounds like diagnosis is really about putting the whole picture together, the history, the exam, the lab results, to confirm hypothermia and rule out other causes.
Sure.
Once it is diagnosed, what are the main treatment steps?
The absolute priority is emergency care, usually inpatient intensive care, until their temperature is back to normal and they're stable. The exact nursing care depends heavily on the stage.
Okay.
For stage 1 and 2, we usually use active external rewarming. Things like warm blankets, heating pads used very carefully to avoid burns, radiant heat lamps, maybe warm water baths, or forced warm air blankets like a bear hugger. Giving warm V fluids is also really important. But one thing you have to watch out for here is something called core temperature after drop.
Core temperature after drop. What's that?
It's when you start warming the outside of the body, the limbs especially, and that cold blood from the periphery flows back to the core, actually causing the central body temperature to drop even further temporarily.
Oh, wow.
Yeah, it can be dangerous. So to minimize that risk, the general advice is to focus the warming on the animal's trunk, their core, before focusing heavily on the limbs.
Warm the core first. Makes sense. What about the really severe cases?
Sure.
Stage 3 and 4?
Right. For those critical patients, besides the warmed IV fluids, We might use warm humidified oxygen to help with breathing and warming. We can do things like bladder lavage or gastric lavage, basically flushing the bladder or stomach with warm saline to transfer heat internally.
Okay.
Then there are more advanced, more invasive techniques. Things like closed thoracic lavage, washing out the chest cavity, or peritoneal lavage, washing out the abdomen. Even more advanced options are things like hemodialysis, special continuous rewarming circuits using blood vessels, or even cardiopulmonary bypass in extreme situations.
Wow, some serious interventions there.
Definitely. But one thing that's generally not recommended is just plunging the whole animal into hot water.
Why not?
That can cause sudden, massive vasodilation, blood vessels opening up wide, leading to a drastic drop in blood pressure, dangerous heart rhythms, and potentially cardiovascular collapse. A slower, more controlled re-whipping is usually much safer, especially in severe cases.
Got it. Controlled warming is key. What about other supportive care? Fluids, activity.
Most of these patients are dehydrated initially, so fluid therapy is vital. We use warmed crystalloid fluids, aiming for around 104 Fahrenheit, 40 Celsius. But you have to monitor very closely for fluid overload during resuscitation.
Right.
Low blood pressure is usually treated with more fluids first. Drugs to support the heart, inotropes, are generally only used if the blood pressure doesn't respond to fluids. If there's respiratory failure, they might need mechanical ventilation, a breathing machine.
Okay.
For animals that aren't too badly affected in the early stages, gently encouraging them to move around can actually help them generate some internal heat. But you should definitely hold off on food or water by mouth until they're fully alert and can swallow properly.
Good point. And what about prevention? What advice can we give pet owners?
Oh, client education is so important here. The main thing is preventing prolonged exposure to cold, especially for the high-risk groups, the very young, the very old, pets with underlying health problems, or those on certain medications. Basically, keep pets indoors when it's cold. They have to be outside, make sure they have proper shelter, maybe consider coats for some dogs in really frigid weather. Just common sense, really, but crucial.
Simple but vital steps. Are there specific drugs used to directly treat the hypothermia itself?
The main one directly related is giving dextrose sugar if the patient has developed hypoglycemia, that low blood sugar we talked about.
Right.
But there isn't really any evidence to support using things like steroids or antibiotics routinely unless there's a specific secondary infection or reason for them.
Okay. And once treatment starts, what kind of monitoring is needed? How closely do they need to be watched?
Very closely. Continuous core body temperature monitoring is essential. Continuous ECG to watch the heart rhythm. Frequent blood pressure checks, like ideally hourly during active rewarming.
Wow, hourly.
Yeah. Regular checks of electrolytes, acid-base status, blood count, protein levels, blood glucose, maybe every 6 to 12 hours initially. And in the more severe cases, daily checks of kidney function, BUN, urine concentration, clotting times, liver enzymes might be needed. It's very intensive monitoring.
It sounds incredibly hands-on. Looking ahead then, what are some potential complications that can pop up during or even after treatment?
Well, we mentioned the core temperature after drop. Another issue during rewarming is that as the peripheral blood vessels dilate, it can actually cause another drop in core temperature if you're not careful.
Paradoxical, yeah.
There's also the risk of accidental burns from heating devices if they aren't used properly and monitored closely. And as that cool blood returns to the heart from the periphery, it can sometimes trigger arrhythmias. And sadly, even with the best treatment, cardiac arrest is still a risk in very severe cases.
And the overall outlook, the prognosis, what can people expect?
It's really variable. It depends heavily on how severe the hypothermia was, how long it lasted, whether there was an underlying cause, if it was secondary, and just the animal's overall health to begin with.
Makes sense.
Mild to moderate cases, especially primary ones caught early and treated right, often have a good prognosis. But severe hypothermia is definitely life-threatening. The outcome really hinges on how quickly and effectively they can be rewarmed and whether any permanent organ damage occurred.
This has been, wow, an incredibly thorough and really insightful deep dive into just how complex veterinary hypothermia is. If we were to sum up some key points, it's clearly a really serious condition. It affects pretty much every system in the body. Spotting those risk factors and the signs early on is absolutely crucial. And the treatment needs really careful, continuous management to avoid those complications we talked about.
Absolutely. And it just highlights how finely tuned the body's internal environment is, and the incredible systems it has to maintain that balance systems that can, unfortunately, be overwhelmed.
It really does. It makes you appreciate the body's resilience when it faces something like this, but also how critical that timely veterinary help is in tipping the balance back towards recovery. Kind of leaves you thinking, doesn't it? Would other simple environmental things like temperature have such massive complex effects on how our animals' bodies work? It's definitely food for thought. Thank you so much for joining us for this deep dive.